Welcome to another edition of Five Good Things. This is Megan Antonelli, founder of Health Impact Live, and I'm here today with Janae Sharp, my friend and co-host and founder of the Sharp Index. Hi, Janae.
Hi, it's great to be here today. I'm excited to talk about the great things going on right now.
Me too. There are some good things happening in healthcare, some good things happening in the world, some good things that, have some big buts associated with them that maybe are good things, but
some notable things certainly have happened this month.
For sure. Like women went to space.
Yes.
Is that a good thing?
Yes. Well, there are some good things about it. As we know, Katy Perry had the song E.T. with Kanye West, and we're one step closer to finding an alien lover. We also know that they are better than deep sea exploration because they didn't use an Xbox controller, I think.
Wow. Those are some really interesting good things.
Yeah. Fun fact, over 104 women, I think just 104 women have been to space, but this was one of the first all women.
Does that include the women that just went to space?
Yes.
Wow.
So it's pretty low. It's a low number.
How many men have gone to space?
Let's look at it.
How many went up?
385.
Oh, wow. Okay. Well,
So it's a slightly better.
About a quarter.
It's a better balance than we have with male to female executives in healthcare.
Kind of, yeah. I thought the good thing that really came out of that were the memes. And, it was definitely an interesting thing to watch happen. I think I wanted to feel like it was something that was maybe empowering, but it really did not feel that way. And I think I think the response, like Gayle King being upset about it, about the fact that people weren't excited about this and that they saw it as a publicity stunt, was handled really badly. Because I think that ultimately, if she had just said, we had to send famous rich women to space to get you to pay attention, that would have been from an authentic place. But instead, she said, I'm an astronaut, and she kissed the ground when she got back. And that to me was a little bit of, I don't know.
Yes, it did seem a little bit like rich people cosplaying normal people, cosplaying astronauts. And that is their thing.
Right. And why are we talking about it? Because we like to talk about great things that women do, and we like to talk about women empowerment. But when women empowerment is used as a
publicity
opportunity for publicity,
or a way to flaunt that you have things that other people don't have, when a lot of people in the country are struggling, it's rough. Like you have to be really mindful of how you approach even your fun outings,
And it does. It felt like a little bit of like distraction propaganda. And it felt a bit surreal as opposed to empowering, which, was the supposed aim. But, good on them for having that experience. I mean, I would love to go to space. I think it would be awesome.
I would not.
No.
No, I don't want to go on a deep sea expedition. I don't want to go to space. Maybe I want to climb mountains, but
maybe I should try hang time at Knott's Berry Farms first and see how I feel about that.
Yeah, I barely like roller coasters. I don't think I want to go to space.
And that's pretty much what it is. So, all right, well, let's get to the show. There are some good things happening in healthcare. Let's not start with the measles outbreak because that's a really big butt. So where do you want to start, Janae?
Okay, let's start with digital health use increasing and growing in underserved communities. There was a highlight of a JAMA study that came out, and they were looking at data from 2022. And I really like that they asked people in the past 12 months, not counting times you went to an emergency room, how many times did you have an appointment with a healthcare clinician by video or phone? For telemedicine, how many times did you receive remote counseling or remotely supervised training or therapy from a healthcare clinician online or by phone? And they found that in a lot of areas, it's increasing.
That is good. I didn't realize that the data that they were studying was from 2022. I mean, it would be interesting to see the snapshot of it now, and of course, kind of like how that. I assume that reflects an increase from pre-pandemic, but that to me is still kind of amidst the pandemic fallout in terms of our behaviors.
Right.
But I imagine that it does continue, and it is good that access is there. Like this week, talking to Joanna Strober, who we have on the show today, MIDI Health and what they've done with virtual health and making that, available to women, all of those tools. And a lot of that came out of the pandemic for them and when they started. And so, and we're seeing that increase. And I did see some other more positive developments around, I think, the Senate, the number of senators who are currently supporting the telehealth bill and the continuation of that. So I think that is good news. Well done.
Yes, I think it's great news. I do think that in a lot of areas, they don't have the care that they need. Like, it's really hard to find someone in network that will provide you with mental health care. In rural areas, it's really hard to find someone in your area. And obviously, we want care where people are, but I love that telemedicine can make things available and make people it creates access for them for care in their communities.
Yeah, no, I mean, it's huge. And we've talked about it a bunch in terms of just that impact that it does have on rural care. But I mean, I live just outside of Los Angeles, and there's a lot of care that we can't get or we have to wait for, and that's why.
Right. I live in Charlotte, and it's a long wait to get like a therapist.
Right. Mental health, OBGYN, all of the women's health and specialties they're not great. There's not a lot available, and there's lots of appointments needed, and there's a long wait time. So it is great to see that, and it's great to see that it's going, it's impacting underserved communities in that way. So that is good. Speaking of rural health, because I can't help myself. I just saw it this morning, and this is not good news. I can't help it. But there's 800 cases of measles in Texas right now, or across the country.
Wow.
680 of them are in Texas, the majority. So I had to look up. And so the good thing in this is that vaccines work, because the question I had, and this is, from my epidemiological, background, was, well, are the vaccination rates lower in Texas, and why? And come to find out, they are. So school case, non-religious or non-health exemption vaccinations are much, much higher in Texas. And it literally correlates directly to not only the rates of the measles epidemic and where we're seeing the increase, but also, where these regions are, and then the sort of rural versus urban. So you can see the pockets of higher vaccination rates are closer in the cities, and as you go outside. And so I think it speaks to both. I was just watching Dr. Nair and I'm forgetting her name. Your friend from Premier,
Casey Kalpin.
Yes, Casey Kalpin. They did a great podcast with Chrissy Farr about misinformation and Dr. G's book and that right. topic and what that means. And I just think we're seeing this huge spike happening once again. And the only thing I'm going to take from that is vaccines are good. And I'm going to spread that word that it is important to get your children vaccinated because they work. And herd immunity is an incredibly important part of the process of this country staying healthy and us stopping the spread of infectious diseases.
Right. I can tell you love public health. I mean, I grew up in Clark County, Washington. We, home of the original measles outbreak before it was trendy to really talk about how bad vaccines were. And I do think people are learning, like these high rates of it's an important topic that obviously has been bothering a lot of people for years, right? Mm-hmm. And it's something that it seems like hopefully they'll have better data about.
For sure. Another good thing, which I know we've talked about already, but if you haven't watched The Pit, Janae, Gotta watch it.
I haven't watched it. I need to.
You have to.
Isn't it on HBO?
No, I think it's Paramount. And the thing about that is what they do. I mean, in addition to physician and clinician burnout, which they deal with aggressively throughout the whole season, the stories and the patients that they handle that come in. One of them is a mom who does not want her child, who has not vaccinated her child, who does not want her child to get a spinal tap. And I've actually been in that situation of not wanting my little baby to get a spinal tap, and I empathize with it tremendously. But at the same time, the vaccination piece. So they really hit all of these stories, and in some ways that is the storytelling piece of that, and how television is a medium. We still watch it, and there are opportunities. And that brings me to another good thing, which is our Health Impact conference in June,
Yes.
which we are focusing quite a bit on storytelling and the extension of, how you can take sort of culture, society, and use that to combat and educate people and engage them in their health, and that continuity of, we talked about in January around, music is medicine, music and health and art and medicine. And now just sort of that whole bigger picture around storytelling. So Gary Forbes, who we talked to today, and his great book series called Soul Survivors, and the way that, positions the kids as superheroes, all good things.
Yes. And I love that the pit also is giving great information. Like I've talked to people, they're like, I almost think I feel bad for how stressful it must be for healthcare providers. And it's like, wow, imagine learning something on TV that actually helps you learn empathy and gives you accurate medical information. That'd be crazy. It's crazy.
Right. Well, so super interesting, totally a side note, but that's what we're here to do. I, of course, watched ER when ER came out, I think, religiously. So I had to go back and watch it. And I started, and what I didn't realize is in the pilot, Juliana Margulies, who is the head nurse, attempts suicide through a drug overdose.
Ooh.
And I didn't realize it then. But the thing about it is that they don't make it about her work. It's about her relationship with George Clooney. Right. And that, but it kind of frames that difference both between how we looked at the medical profession in the 80s, 90s, whenever that was, a long time ago.
Just yesterday.
And now where we do see that they are, that this is a real people, and the job is what impacts them, not their relationship with McDreamy or George Clooney that tends to, to dominate the stories that we watch as children, or as teens, or in some cases where maybe we're too young to watch at all.
I didn't watch. But it's delightful that people aren't blaming George Clooney anymore. He seems like a delightful husband and father.
Yeah. Well, he was not a great actor, I will say. That Noah Wiley was.
I wouldn't know, but I think his wife is incredible.
Yes.
Human rights attorney. We love that.
We only have a few minutes left.
Speaking of human rights,
other good things.
Let's talk about environmental impact. We talk a lot about artificial intelligence. I think it was last week that OpenAI said being polite to OpenAI is costing us a lot in energy. So your thank you and your please costs a lot of operating power. And that's one of my concerns when we talk about AI in healthcare. Like, are we improving overall health when we need so much power for the computing behind it? And it's a question that healthcare leaders are facing head on. So the good news is that people in healthcare understand that all this power is impacting people's health. And they announced that places like Advent Health is investing in renewable energy and has been working on, solar power and wind power. And I live in North Carolina. Just a few months ago, the power grid in Asheville after Hurricane Helene was just wiped out. So it's great news for me to see people in healthcare taking that leadership to think about what is actually needed to improve health and also reduce the impact.
Yeah, it is. I mean, I think it's such an important topic. And I think, yeah, the whole AI piece of it is even, it's just another step of that. I mean, if you think about the waste that was in the supply chain in healthcare, in reusable and non-reusable one-time use things, I mean, it's almost built into some of the workflow. And there's so much. I know Kamal Bajaj at New York Health and Hospital System and, the folks at, came in January to talk about a lot of that at HealthIMPACT. And it is a, ongoing developing concern. And there's certainly some great initiatives. And I, with the current administration, you worry that the focus will shift a little bit, although RFK Jr. was an environmental lawyer. So maybe it will increase. Who knows? It's hard to say. Things are rather uncertain.
Well, I think the amount of impact that healthcare has might be similar to the amount of GDP they control. So if they're improving things, that's great news for all of us.
It is for sure. And Advent Health is a, expansive.
And I was going to make a joke about some guy selling solar online, but it wasn't that funny.
That's okay. we could talk about something else. But I think it is great to see Advent doing that. They really,
I think Kaiser Permanente is also doing something like that.
Mm-hmm. Awesome. That is good news, especially because it's Earth Day. April is Earth Day, Earth Week.
Yes, we had Earth Day this week, and my 6-year-old was thrilled about it and turned off all the lights in our home.
All right, we only have 2 minutes left.
All right,
what's our final good thing? It has to be another big but. The AI uses what nurses see and the death risks plunges 36%, but the grant was pulled. We have to talk about it though, not only because they saw incredible results using this AI system that was developed by critical care nurses at New York Presbyterian and Mass General, but because our best favorite critical care
and repeat guest and
panel
speaker
Cato was involved in that. And so a 36% drop in hospital deaths attributed to AI. But the research was abruptly canceled due to the Trump administration. However, we hope by shedding some light on this, but that, it will come back and it will get pulled back. That, we've seen a lot of things get pulled and then, oops, they give the funding back. So we hope that with the attention that our friends, the first person who saw that, so I saw this online because Michael Millinson wrote about it on Forbes. So good on you, Michael, for shedding light where light is needed. And congratulations to Kenrick on having such good results. And let's hope that by the time the show airs, the funding has been returned and replaced to where it should be.
I love that. That's a good thing. I know we only have like 30 more seconds, but I think we should mention that SCAN Health Plan and Sutter Health have paired up to provide better offerings for Medicare Advantage in California. So Dr. Jane's been a guest as well speaking. And I think it's great that they are working to provide innovative partnerships and models for Medicare Advantage. Baby boomers, they're reaching the age of retirement. I think 2030 is the last year when they'll all be there. And we got to prepare for taking care of the old people.
And if anybody still has jobs left, it will be, quite a retirement. So on that note,
they don't need jobs if they're retired.
On that note, thank you everybody for joining us both for HealthIMPACT Live today and for Digital Health Talks and our segment of 5 Good Things. Thanks, Janae. Always a pleasure chatting with you about all the good things.
Yes, we're looking forward to hearing more good things. Please message us, tag us, let us know.
Yes, follow, like, and share. Signing off, Megan Antonelli and Janae Sharp.